I am Vicki Kohler, a Quality Improvement Advisor in the HQuinn Network. I am joined by our guest, Cindy Warriner, our Senior Consultant Pharmacist, to discuss these changes and updates. Cindy has worked in the Quinn QIO for 8 years with a focus on med safety, opioids, chronic disease, and vaccination. Previously, she was a practicing community pharmacist innovating the front lines to improve innovative pharmacy services and team-based care. She's also had the opportunity to serve for 8 years on the Virginia Board of Pharmacy, as well as several national task forces. The Health Quality Innovation Network serves Kansas, Missouri, Virginia, and South Carolina. The South Carolina QIO, formerly known as Carolina Centers for Medical Excellence, is now the Constellation Quality Health. Cindy and I are going to discuss the updates to prescriber guidance, MAD updates, and some new overdose and addiction treatment medications. Thank you for joining us today, Cindy.
Well, Vicki, it's great to be here, and I'm looking forward to sharing the information.
That's wonderful. Let's go ahead and get started. There's been several changes impacting the medication-assisted treatment MAT programs, including specific designee requirements. Please help us understand those changes.
Sure. In December of 2022, Congress eliminated the data waiver program requirement for buprenorphine. Now a standard DEA number can be used to prescribe the medication. There is, however, an 8-hour training requirement at either the initial DEA registration or renewal. So let's briefly cover what can satisfy that requirement. The clinician can either be board certified in addiction psychiatry or addiction medicine. The person can also be a recent graduate of medical, dental, PA, APRN school within the past 5 years that have the 8 hours of training as a part of their curriculum. You can also receive it through an 8-hour CME training on either treatment, opioid use disorder, or other substance use disorders. That training can be cumulative or in one session. Please make sure the training is accredited by either the AMA, APA, AAMP, AAPA, or ECHO programs, or maybe an academic detailing training. The training may also be either in person or virtual. Just as an aside, I'd like to also say there recently has been challenges in wholesaler limits. However, those seem to have abated a little bit more for Suboxone versus Subutex. So keep that in the back of your mind when you're picking which product you may want to prescribe.
That's interesting. There are definitely a lot of changes with the removal of the MAT requirement program, Cindy. With the new changes, there's also new buprenorphine drug updates. Could you tell us more about the changes to Brixadi?
Sure. Brixadi is now available in an extended release buprenorphine injection. It was approved in May of 2023. There is a REMS requirement, and it can be dosed either weekly or monthly. This new long-acting injection should be available sometime this fall. Now, Sublocade is still available, and let's remember that also requires a REMS program, and Sublocade does have to be refrigerated. The resource links on this slide provide guidance on initiating MAT treatment for a patient. Depending on what you may need, you may want to print the pocket guide so you have it for easy reference access.
In November, the CDC released updated clinical practice guidelines for prescribing opioids for pain. What are the key areas that changed in this prescriber guidance, Cindy? The MMRW publication is quite lengthy, as well as the guidance itself.
Yes, that publication is fairly long, so let's see if we can summarize it. The CDC released the new opioid prescribing guidelines at the end of 2022. The new guidelines are meant to help frontline clinicians ensure the safest and most compassionate as well as effective pain care. The new guidelines provide suggestions on when to initiate use of opioids, selecting the correct product, dose, and length of therapy. It is stressed in multiple places of this new guidance document that these are intended to only be suggestions. The provider should assess and definitely individualize the care needed for each patient. We have provided the links for your reference and ease of access.
So recently there's been talks of some new medications coming into the market that are antidotes and changes to existing drugs. What should our listeners know?
Well, it's great. Opvi, approved just May of 2023, is a new nasal injection. 2.7 milligrams is distributed per nasal dose. It should be available in late 2023. The manufacturer is Indivor, and the key thing about this, which is exciting, it is long acting. The half-life is 11.4 hours compared to Narcan's 2.1 hours. The link provided gives more specific product information. Now, we also have naloxone going over the counter. Narcan has been approved by the FDA in March of 2023. It's 4 milligrams per dose, and they are in the labeling approval process. Revive, approved hot off the press, July 28, 2023, is a 3 milligram dose. Interesting about this product, the company producing it, Harm Reduction Therapeutics, is a nonprofit company and hopes to make this product affordable for the consumer. Cloxidoo has been available for quite a bit, but let's just quickly review. It's an 8 milligram nasal spray that has a similar half-life and onset of action to Narcan. Once again, there are additional links on this slide for resources.
A topic that doesn't get discussed as often as perhaps maybe it should be is potentiators, prescribed along with these opioids that can have devastating outcomes. Can we discuss what the potentiator concern is and maybe identify some of these potentiators?
I'm so glad you asked because this really isn't discussed often enough. An opioid potentiator is a drug, herb, or entity that can either intensify or elongate the effect of opioids or a high in the case of illicit drug use, both of which can really raise the risk of an overdose. Most of you may be familiar with some of them, but I'm sure there might be surprises. Let's quickly mention a few. Grapefruit or some orange juices, pseudoephedrine, diphenhydramine, diazepam, cyclobenzaprine or Flexeril, alkaloids, gabapentin or Neurontin, Soma, doxylamine, which is in NyQuil, orphanadrine, barbiturates and Dimetap, and of course, one of the ones that I think sometimes is missed, dextromethorphan, which is in quite a few of cough syrups and cough medications. Additional in-depth information is provided by the resource links.
Although this podcast is really intended to address clinical prescribing and treatment changes and updates, there's a new concern around the medication affecting overdoses called Zixaline. The current administration just released a national response plan. What should providers know?
Well, first off, Zixaline has never been approved for human use. It is a potent animal tranquilizer that is not an opioid and is being mixed with fentanyl, placing users at a higher risk of fatal overdoses. Because it is not an opioid, Narcan does not reverse its effects. Links provide additional details and information.
Great. Thank you, Cindy. That's very important maybe for our providers to understand. A conversation also that isn't discussed often is providers talking to patients about proper disposal of opioids or prescriptions. How can providers help patients dispose of their unused or expired narcotic medications to ensure these medications don't land in the wrong hands? What's the messaging for providers?
Great topic again. Pictured on this slide is a snapshot of the FDA drug disposal infographic. The link is provided below the picture. You can also do a computer search or ask your local pharmacist for local disposal sites and disposal directions for patients' medications. On the right-hand side of the screen is a patient-specific program to assist and explain the importance of cleaning out your medicine cabinet and disposing of unneeded meds properly. Clinicians might want to consider using this resource as an educational tool to share with patients that are being prescribed or taking a narcotic.
Thank you for joining us in this engaging discussion today, Cindy. It was great to have you with us. For our listeners, this slide is an informational slide to help providers with additional continuing education requirements and opioid harm reduction. If you would like any additional information about any of this information shared or for assistance with opioid harm reduction, please contact Cindy or myself. Our information is shared on the screen as the easiest way to connect with us today. Thank you.